Mrs. Bellman, how are you?
Good.
Good. My name is Duggar. I'm a student nurse at Mesa Community College, and I'm here to check your vital signs. Is that all right?
Yes.
All right, I'm going to go ahead and draw the curtain for privacy. And then I'm going to do hand hygiene for a minimum of 15 seconds. I'm also going to take my stethoscope and I'm going to wash it with warm soapy water and get it clean as well. And I'm going to go ahead and put on a pair of gloves. How are you doing today?
Good.
Good. If I get my gloves on here, I want to go ahead and check your wristband, if that'd be all right. And take a look at your wristband. Can you tell me your full name?
Stella Bellman,
And your date of birth?
2641.
Thank you. Do you have any allergies, Mrs. Bellman?
No.
Okay. Well, let's go ahead and start by taking your temperature. You can go ahead and open your mouth and set that down in there. Beep. And it's 37 degrees Celsius, which is normal. That's around 98 degrees for you. Or 98 degrees Fahrenheit. The normal range for Celsius is 36 to 38 degrees Celsius. Next, what I'm going to do is check your heart rate. I'm going to do this by palpating the radial pulse. And I'm going to count to 30, and then I'll times that times 2. And the number I get is 40, times 2 is 80, and that's, your pulse rate is 80 per minute. And normal range is 60 to 100, so that falls within the normal range. While I was palpating that, I also watched how many breaths you were taking, and I counted to 30 as well. You took 8 breaths in 30 seconds, times 2 is 16 breaths, and normal respirations are 12 to 20, so that's within the normal range. Next, we're going to do your blood pressure. We'll go ahead and use your right arm here. I'm going to take a blood pressure cuff. I'm going to put it on the upper 1/3 of your arm. I'm going to go ahead and put that on. And what I'm going to do is I inflate the blood pressure cuff. I'm going to palpate your radial pulse. And as I inflate it, I'll be feeling for when that pulse disappears. As soon as it disappears, I'm going to go ahead and inflate the cuff 30 more, and then I will start to release it. So I'm going to inflate the cuff. I no longer feel the radial pulse. I'm going to go 30 higher. I'm then going to take my stethoscope and put it on your brachial artery and start to slowly release the blood pressure cuff. The first Korsakoff sound that I hear is the systolic number. I will then continue to release it until I hear the last sound, which is the 5th sound, and that is the diastolic number. And your blood pressure was 118/78, which is in the normal range. Normal is 90 to 140 millimeters per mercury, and that is your systolic number. The normal for your diastolic number is 60 to 90 millimeters of mercury. So you fell within that normal range. So that's all we have for the vital signs. Now we're going to move into the head to toe assessment. And I'm going to start by examining your head. So I'm going to take a look in your hair. Is that all right with you?
Yes.
Okay. So I'm going to look in your hair, make sure that I don't see any ticks or lice or anything that's abnormal or not symmetrical. Then I'm going to go ahead and I'm going to take a look at your face. If you can look at me, I'm going to look for symmetry, make sure that your ears are symmetrical. If you can go ahead and stick your tongue out for me. Okay, your tongue looks normal. Have you been having any problems with your throat, sore throats, or swollen glands in your neck?
No.
Everything feels normal there in these glands?
Yes.
Okay. I'm going to go ahead and take off my gloves now, dispose of them properly. Go ahead and do hand hygiene again for a minimum of 15 seconds. What I want to do now is go ahead and take a look in your eyes. I'm going to take this pin light and I'm going to shine it in and out of your eyes. And what I'm looking for is to see if your pupils constrict. And while I look at the first one, I'll then check the second one to see if they're constricting together. So go ahead, let me take a look at this. As I move the light in and out, the constriction happened on both eyes. And I'm going to do the other eye, and they both constricted at the same time. The other test that I want to do with your eyes, have you been having any difficulty with your vision?
No.
Okay. I'm going to do an accommodation test. I want you to take a look at the end of the pin light here. As I move it towards you, just focus on the end of that pin light. And what I'm checking for there is to make sure both of your eyes move together as I come in with that pin light, and they do. I just wanted to make sure that one eye didn't go off to the side while the other one came in. What I'm going to do now is go ahead and assess your arms. I'm going to do this by inspecting them. I'm going to look at them. I'm going to see if there's any bruising, any peeling, any dryness. the other thing, or bruises or bumps. I also want to feel the moisture content, and they are dry, which is normal, and make sure that there's not too much heat. They're nice and warm, but not too hot. And I'm going to come down your arm here, and I do want to palpate your radial pulse to make sure that it is present, which it is. I want to make sure that it's not weak or thready, or that it's not full or boundy, and it is normal. Next, I want to do what's called a skin trigger test. And I'm going to go ahead and pinch the top of your skin here and release it. And as your skin quickly went down, that means you're not dehydrated. If it would have tinted, stayed up, then it would have means that you could have had some challenges with dehydration. Next, I want to do capillary refill. I'm going to do this by quickly pressing down on your nail bed and releasing, and making sure that the blood returns to the nail bed quickly, which it does. So everything's normal there, everything's normal to inspection as well. I would do the same thing on the other arm as well. Now I'd like to go ahead and listen to your lungs. Have you been having any difficulty breathing? Any congestion in your lungs?
No.
Things normal? Alright, if you can go ahead and turn sideways here for me. Mrs. Bellman, I am going to need to put my stethoscope right on your skin. Is that alright with you?
Yes.
And then I'm going to be listening to several locations throughout your lungs. And what I'm going to do, each time I put my stethoscope on your skin, I'm going to ask you to take a deep breath, okay?
Okay.
I'm going to start up high here, and these are the bronchioles, and that's where I'm going to start listening. So if you can take a deep breath. Again. Perfect. Now I'm going to move down a little bit lower to the bronchial vesiculars. You can take a deep breath. And one more time. Perfect. So everything sounded normal. There was no abnormal sounds within the bronchioles or the bronchivesiculars. I'm going to now move lower into the vesicular area, into the lung fields. I'm going to need to lift your shirt, okay? And I'm going to be listening to several locations on these vesicular areas. And we're listening for advantageous lung sounds, which are abnormal. I'm going to start here in the vesicular area. If you take a deep breath. Again. Move to the other side again. 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 Then I'm going to do over here on the side. And then up under the axillary. Deep breath. Come over here and listen to one more spot on the vesicular area. Deep breath. And then over here on the side. And then up under the axillary area. Deep breath. Good. Everything sounds normal in your lungs. I didn't hear any wheezing or crackles or stridors. Everything sounds normal there. So if we can turn back around here for me. What I'm going to do now is I'm going to inspect. We're going to listen to your heart sounds and inspect your chest and your abdomen. As I inspected your lungs on your back, as I inspected your back, everything looked good. All your skin was intact. There was no bruising or any bumps. So can I go ahead and listen to your heart sounds now?
Yes.
Okay, what I'm going to do is start by listening to the S1 sound, which is found over the apex of the heart. It's the PMI, which is the pulse of maximum, the point of maximum impulse, the point of maximum impulse. And that is found on the left mid-clavicular line, the 5th intercostal space. So I'm going to need to get right up under here under your breast, and I'm going to listen to that for a full 60 seconds, okay? And again, that is the S1 sound. So I'm going to lift here. I'm going to come over to the left mid-clavicular line, come down to the 5th intercostal space. And then I'm going to listen for a full minute. And again, I get 80. And the normal pulse rate for that is 60 to 100, so you fall within the normal range. The other spot that I want to listen to on your chest is the S2 sound, and that is found on the left sternal border, the 2nd intercostal space. So I want to listen here. And that's over the aortic valve, and that is the S2 sound, and everything sounds normal there as well. Have you been having any chest pains at all?
No.
Okay. Next, I'd like to examine your abdomen. So if you kind of just lean back for me. Go ahead and lift your shirt up for me. Your abdomen has 4 quadrants divided at the umbilicus. I'm going to start in the lower right quadrant, and I'm going to listen for 5 seconds in each quadrant, okay? Have you been having any constipation or diarrhea? Any abdominal cramping?
No.
Okay. Then I'm going to move up to the right upper quadrant. Have you been having any problems with urination?
No.
Have you been having frequent bowel movements?
Yes.
When was your last bowel movement, Mrs. Bella?
This morning.
Okay. Now I'm going to move over to the left upper quadrant, and then down to the left lower quadrant. I'm going to inspect your abdomen, make sure that I don't see any distensions, or any bumps, or any abnormal signs. I want to palpate the stomach, make sure I don't feel any masses. Do you have any pain there?
No.
Okay. What I was listening to for bowel sounds is frequency of the bowel sounds, gurgling noises. And it's normal to have them. If you're not having any, it could be a sign of constipation or an obstruction. If you're having too many, it could be a sign of diarrhea or an infection in the gastrointestinal tract. So everything is normal there in your bowel sounds. So let's go ahead and we'll move down to your legs. I'm going to inspect your legs. And once again, looking at the skin, feeling for moisture, making sure that it's dry and warm but not too hot, looking for any bruising or any peeling of the skin. I'm going to come down here, I'm going to take a look down your calf area. I'm going to come down to your toes. Once again, I'm going to do the capillary refill test by pushing down on the nail bed and releasing and making sure that the blood comes back into the nail bed to make sure that you have good circulation. That's what that capillary refill test does, make sure that the blood is circulating well. Next, I want to check for a couple pulses down here in your lower extremity to make sure that you're getting good blood circulation. The first one I'm going to check is the dorsal pedal, and that is here on the top of the foot between the large and the second toe. And all I'm feeling for here is just to make sure that your pulse is present. And once again, that it's not weak or thready or full and bounding. And that feels normal. Next, I want to check the posterior tibialis here, which is found on the inside here. And once again, I'm feeling for a presence of a pulse, but one that's not weak or thready or full or bounding. And that feels normal as well. Next, what I want to do is a test that checks for deep vein thrombosis. Basically, it's a clot in the leg. So what I want you to do, this is called the Holman sign check. I want you to take your toes and I want you to flex them towards your head for me. Do you feel any pain as you do that? Okay. Does that hurt at all along your calf here? Okay, and I'm not feeling any excess heat. I don't see any bruising. So that's a normal sign. So everything looks good there. So as we've gone through and we've inspected and we've checked all these different things and done this complete physical assessment, everything looks normal. I would have done the same thing on the other leg as well and done the same checks. So I want to thank you, Mrs. Bellman, for the opportunity to be able to assist you today with your health care, and it's been nice meeting you.